Good afternoon, and thank you for joining us for today's webinar on managing heart and vascular health during COVID-19. A couple housekeeping notes before we begin. In this platform, all attendees are muted. While you won't be able to ask your questions through your microphone, please note the Q&A function at the bottom of your screen. If you have a question that is not addressed in the presentations, feel welcome to submit through the Q&A feature, and our presenters will try to address as many as possible at the end of their presentations. Also, today's webinar is being recorded and will be available for viewing on demand in the near future. It will be posted on our University Hospital's website, and as an attendee of today's session, you will receive an email with that link. It is now my pleasure to introduce our co-presenters for this session. Dr. Sanjay Rajagopalan is Chief of the Division of Cardiovascular Medicine at University Hospital's Harrington Heart and Vascular Institute, Director of Cardiovascular Research Institute at Case Western Reserve University, and the Herman K. Hellerstein Professor of Cardiovascular Research. Dr. Rajagopalan completed fellowships in cardiovascular medicine and vascular biology at the Emory University School of Medicine in Atlanta, Georgia, and advanced cardiovascular imaging training at Duke University. He is among an elite group of clinician investigators whose work has transformed perceptions of risk factors in cardiovascular disease and facilitated the development of innovative approaches to diagnose and treat cardiovascular disease. Presenting with Dr. Rajagopalan is Dr. Heather Gornick. Dr. Gornick is co-director of the Vascular Center at University Hospital's Harrington Heart and Vascular Institute. She completed medical school at the University of Chicago and did training in internal medicine, cardiology, and vascular medicine at Brigham and Women's Hospital, Harvard Medical School in Boston. Dr. Gornick is an expert in the care of complex vascular diseases, particularly fibromuscular dysplasia, a rare disease of the arteries. She is a leader in multiple national vascular organizations and is the editor-in-chief of the journal Vascular Medicine. Dr. Gornick sees patients with heart and vascular disease at University Hospital's Cleveland Medical Center, Ahuja Medical Center, and Elyria Medical Center. And now I will turn it over to Dr. Rajagopalan.
Thank you, Tiffany. It's such a pleasure and honor to be here with you, and I'd really like to thank our participants for making the time. I think these series of events that have been organized are very important from an educational perspective, and it's very timely as well. And it's a particular pleasure to be here together with all of you, with my colleague and good friend, Dr. Heather Gornick.
Jay, hello. Glad to be here.
Thank you, Heather. So, you know, one of the reasons we wanted to do this is really the time that we're in. Here before you is a slide looking at a dashboard of COVID-19 throughout the world. And this is a generational event that's been seismic and has cataclysmic consequences. And you know the statistics. I'm not going to bore you with that. Neither am I here to talk about, you know, the dire statistics and the economy and stuff like that. The main reason why we wanted to reach out to you in the form of these educational seminars is to really tell you that we care about you. We want to be here to guide you through this difficult time, particularly for individuals with prior cardiovascular conditions, because this disease that we are dealing with has a lot of implications for those with prior cardiovascular disease. And given the complexity of the circumstances, we thought that we really ought to reach out, have an educational seminar series so that we can actively engage you and guide you during this difficult time. Patients are having difficulties even navigating the health system. They are frightened. And this is one of the major reasons why we wanted to get in touch and reach out to you. So this format is very interactive. Hopefully at the end of it, we'll have lots of questions and answers that both Dr. Gornick and I would be more than happy to share and partake in. So in Ohio, we've been lucky. I think we have really weathered the storm relatively well so far, thanks to the governor, thanks to the social distancing measures. It's been quite effective. And we have really seen a marked reduction in the number of cases over the last several weeks, ever since the gubernatorial decision to reduce procedures in the hospital and keep it to essential procedures went into effect. But what's also happened is that undoubtedly, partly because of the fact that there was a mandate to keep hospitals just doing essential procedures and reduce unnecessary things that might result in conserving PPEs or personal protective equipment, we've also seen a dramatic reduction in things like heart attacks, serious conditions like strokes and heart failure. And that's really got us worried. So you can see in the slide, there's been a reduction and there's been some national statistics in this area and up to some hospitals throughout the country, and this is just not an Ohio phenomenon, this has been going on throughout the rest of the country, where there's been up to a 50 to 60% reduction in the volume of cases. And this has really got us worried. Obviously, there could be a number of reasons for this, but one of the reasons why we'd like to have this is to ensure that people with conditions that are serious are seeking treatment appropriately. And we also thought that it's important to provide some guidance information as to where they can seek care, how to go about it. There's a whole conversation, national conversation about virtual visits, and we wanted to provide all of you the opportunity to get this information and also get guidance on where to go for care. So having said that, I think you've probably spent a lot of time learning about this virus, and this is a slide that depicts the coronavirus, referred to as SARS-CoV-2, because it's related to a prior virus during the early 2000s that resulted in a lot of casualties. This virus is a pretty tricky customer. As you can see, the reason why it's called a coronavirus is because it looks like a crown. It has a number of protein spikes that come out of the cell membrane and enables the virus to stick to the cells in the body. And the way the coronavirus engages and attaches to the body is through a cell surface receptor here, and it's shown here in the slide, called angiotensin converting enzyme. And you can ignore that for a moment. It's just a mechanism by which the virus docks onto the cell surface of a human being and gets into cells in the body. And it turns out that these receptors that the virus binds to is expressed throughout the system. Clearly, I think these receptors are expressed in the nose, the upper airways, but they're also expressed very highly in the heart. And that has a lot of implications for patients with cardiovascular disease, because a number of the presenting symptoms for COVID-19 is very relevant to cardiovascular disease. So this slide depicts the symptoms that we're all very familiar with. I think we know that fever, fatigue, and chills are often the presenting symptoms for a number of patients infected with COVID. But what's been surprising is also some of the unusual manifestations, which actually turn out to be less, not so unusual. So these are symptoms like nausea, vomiting, diarrhea, etc., which could cause some of these symptoms to be confused. And this has resulted in COVID-19 initially not being picked up. And now as physicians and clinicians are getting familiar with the virus, they are now very sensitized to the fact that COVID-19 might have lots of unusual manifestations, and a clinician or a physician needs to be sensitive to these types of presentations. The other thing that's very, very surprising, but now we all acknowledge this to be a major problem, is that 20 to 35% of patients who are COVID-19 also demonstrate heart involvement. And this has a lot of implications. This slide depicts how COVID-19 can affect the cardiovascular system. And you can see a little picture here of heart muscle. And inflammation of the heart is a very common presentation, and this often can mimic a heart attack. It can also present with acute coronary syndrome, the technical term for a heart attack. It can present with clotting disorders, so patients can develop thrombus or clot formation in the venous system, as well as the arterial system. And finally, it can cause shock. And this is sort of the real severe presentation of COVID-19, where patients have low blood pressures and are direly sick. So as you can see, the cardiovascular presentation of COVID makes it rather worrisome, because a lot of these patients, especially with prior cardiovascular disease, might be at risk for these types of presentations. And that's what we've learned over the last several months. Thanks to a number of papers, we've learned that fatality rates for patients who present with COVID is especially high. So if you have prior cardiovascular disease, hypertension, chronic pulmonary disease, or respiratory disease, if you have underlying diabetes, or if you're obese, you can see the case fatality rates, which are much higher than a patient without this condition, without these conditions, who might present with COVID-19. So this, again, is a very important point. As patients with prior cardiovascular disease, it is especially important for us to be aware of these associations so that we could take necessary precautions to avert any exposure to COVID-19, if at all possible. I have one final slide before I turn this over to my colleague, Dr. Gornick, who's going to give us a lot of helpful information. And I really wanted to take this moment to really convey to you how important it is to use a mask. There's been a lot of misinformation going back even to some of the bodies like the CDC about using masks, not using masks, but I think it's a lot clearer now that masks are indeed highly effective in reducing exposure to unsuspecting victims around you, and certainly protecting yourself from others whom you might come into contact with. So the recommendations are that whenever you go out, whenever you have a possibility of coming into contact with other individuals, the usage of a mask is highly recommended. And this slide depicts what goes on. So this is an individual, and you can see when you cough, you generate a whole bunch of particles. And some of these particles are large, they're over 100 microns. And these large droplets, as they're called, depending upon whether a person is coughing, sneezing, or simply talking, can have a wide range of dispersion. So you can see here, when you cough, because of the velocity, you can get these droplets going across for more than 6 feet, and some studies show even more than 15, 20 feet. And if your individual is not wearing a mask, and you can come into contact with these spray droplets that carry the virus, there's a very high likelihood of exposure. Now you have these smaller droplets that are much smaller, and these also are worrisome because they can also carry the virus. But the good news is if you were to wear a mask, you can essentially eliminate exposure to most of the large droplets. Now, some of the smaller droplets, which get down deep into your lungs, shown here, can also be averted by a mask if worn properly. It's all about wearing the mask properly, but it can avert exposure to the smaller particles as well. And clearly N95s are very effective. And unfortunately, there's a shortage of this, and it's being used primarily in health situations. But the good news is for most individuals out there, just wearing a simple mask, even a cloth mask, can be highly effective in averting exposure. So I wanted to stop there and segue on to Dr. Gornick, who's going to spend some time talking to you about some tips and what you ought to be doing during this time. Over to you, Heather. I'll stop sharing and allow Dr. Gornick to share her screen. Thank you.
Pardon me, Dr. Gornick, I believe you are on mute, if you don't mind.
Laughing
Oh.
because That's
There
the
you go. We can hear you now. Thank you.
big webinar faux pas. Excuse me. First,
No problem.
it's great to see so many people interested in joining us this afternoon, and we are very pleased to host this webinar. And mainly, the message we want to convey, to echo Dr. Rajagopalan, is that we in the Harrington Heart and Vascular Institute are very concerned that as we focus on COVID-19, we're also focusing on maintaining heart and vascular health, especially for our patients who have cardiac and vascular disease. So here are some things that you could do to stay healthy at home during COVID-19. And these are really common sense sort of things, but I think important to briefly review. And that includes taking medications as exactly prescribed. And as we're going to talk about in a bit, if you're having any problems with your medications, not feeling shy about reaching out to your provider to get help or refills or talk about your concerns. You need to find a balance between being active and resting, and maintaining exercise and cardiovascular fitness as best you can is very important during this time. Obviously want to talk to your doctor about what sort of exercise is right for you if you haven't been doing an exercise program. We want obviously to eat a healthy diet, including lots of fruits and vegetables and whole grains, less animal fat. And I think during this stressful time, want to manage stress and also avoid having stress have an impact on diet with stress eating. Obviously, we need to stay home as much as possible right now due to concerns about our need to socially distance. And as you heard from Dr. Rajagopalan, wear a mask when you have to go out. I want you to wash your hands properly. We'll have some resources at the end of the slideshow. The CDC has some very helpful information about hand washing and other aspects of hygiene. And of course, covering coughs and sneezes with a tissue or your elbow. And then obviously, even though people are sheltering in place, want to stay connected with family and friends through electronic means or writing letters, and also want to stay connected to your healthcare providers. So we want to briefly mention, and I've experienced this firsthand in my practice, that patients have had some serious warning signs at home, but because of the pandemic have been afraid to seek help and actually have just been staying at home with these very concerning symptoms. So I just wanted to take a moment to remind everyone on the webinar about the true emergency warning signs and symptoms of cardiovascular disease. And the warning signs of a heart attack include chest pain or discomfort in one or both of the arms, shoulders, or neck, severe shortness of breath, sometimes nausea and vomiting or cold sweats that goes along with chest discomfort, and dizziness. Those are potential heart attack warning signs and symptoms. And in the setting of these symptoms, this is truly an emergency. Time is heart muscle, and you really do need to call 911 and get emergency medical assistance despite being in this time of the COVID pandemic. I also want to briefly review the warning signs and symptoms of a stroke or a TIA, a mini stroke. And that includes drooping on one side of the face, weakness of the arms or legs, slurring of speech, sudden numbness of a part of the body, or sudden confusion, trouble seeing, trouble walking, or sudden severe headache. And these are potentially very severe neurologic symptoms, especially if they come on suddenly, and could be the warning signs of a stroke or mini stroke. Again, these are the sort of symptoms where you really do need to call 911. There are also other symptoms of heart and vascular disease that are concerning and need medical attention, but don't necessarily require a call to 911. And this would be bleeding or severe bruising if you are on a blood thinner. For those of you with a chronic angina or chest pain syndrome, a different pattern of your chest pain. It's increasing in intensity or with different activities. palpitations or an irregular or racing heartbeat, a shortness of breath when you exercise, fluid retention, which would be swelling or weight gain, especially if you have a history of congestive heart failure, is a very important symptom that we need to get attention for. Swelling or pain in one of the legs, that could be a symptom of a blood clot or a deep vein thrombosis. A sore on the legs that doesn't heal could be a sign of peripheral artery disease. And then if you have high blood pressure and all of a sudden are getting very high uncontrolled readings on your home monitor, or you have diabetes and are getting suddenly very high blood sugar readings, those are things that we really, all of these things, we want to hear about as cardiovascular physicians. You don't need to call 911 necessarily, but these are the sort of things you want to call our office. And I do want to say, we are here for all of your health issues. Our Harrington Heart and Vascular Institute locations remain open, and we doctors and other providers are seeing patients either in person or online or even through the telephone. And we are now, something new, I think, as a result of this pandemic, perhaps something positive that's come of it, is we're now able to offer a lot of our chronic heart and vascular care by electronic means through a virtual visit, either a video chat or a phone call, if not in person. So if you have any of those concerns, or if you are just due for care and haven't received care in many months, call your doctor's office to either go over your questions or arrange for care. And our staff are available to answer the phones and take your calls and help you stay connected. And I just want to end by mentioning these virtual visits. And again, this is something relatively new that we are offering here at UH within the Heart and Vascular Institute. And your care team, your provider, will help determine if a virtual visit is right for you. If you do a virtual visit, you and your patient can actually talk, you can see each other. I can see your living room, and we can even do a quick physical examination. And I think it's a great way I've seen to keep up to date with patients who are staying home during the COVID-19 pandemic. Important to be prepared for the virtual visit. You're going to want to either have a list of your medications or your pill bottles available to discuss with your provider at the visit. And if you don't have a computer or smartphone, obviously most of you do on this webinar because you're joining us today, but if not, a telephone visit can be arranged. So to arrange for a virtual visit, what do you need? You need an email account, you need a device with a camera, could a computer or a smartphone, tablet, or other setup with a webcam, and you need to have connectivity, either Wi-Fi or an LTE telephone connection. And in terms of how can you schedule a virtual visit with your heart or vascular provider, basically you just call your doctor or advanced practice provider's office. Our offices are staffed and people are familiar with how to schedule these appointments. You'll then get an email with the date and time of the appointment and a link to click to start the appointment. And of course, before the virtual visit, you want to ensure that your audio and video work on your device and that you have good internet connectivity, and of course, connect at the appointed time. So I'll wrap up by saying we hope to see many of you who have chronic conditions or any of those warning symptoms that I mentioned that aren't emergency but urgencies. We hope to see many of you virtually. And here's a slide just with some more resources about coronavirus, many of the things that Dr. Rajagopalan touched on. And then I just want to mention this last resource at the bottom. Here at University Hospitals, we have some excellent colleagues in the Connor Integrative Health Network who offer some non-medical solutions to stress. So they have a terrific website with some information on mindfulness, some guided meditations, some suggestions on how to manage stress during this stressful time. And I'll turn it back to Dr. Rajagopalan. But again, thank you for participating in this webinar.
Thank you, Dr. Gornick. That was an excellent summary. And I think these resources should really help provide a lot of information that we might not necessarily be able to get to during this format. But I think Dr. Gornick really highlighted the importance of prevention, doing a lot of the things that we always recommend, diet, exercise, taking your medications, and that's going to be singularly important in reducing your risk. Clearly, I think I'd like to say that there's nothing about COVID-19 that makes heart patients more susceptible, but it certainly makes them more vulnerable for complications. So the best thing that you could do is to go about doing the things that your doctor recommended even before COVID-19, which is to really stick to your taking your medications regularly, don't run out of refills, partake in exercise if at all possible. I know that's been difficult to do given the gubernatorial mandate, but wherever possible, if you can go out with a mask and at least maintain geographic distancing, exercise is always a good thing, and certainly I think would help, avert some of the traditional risks that we know that inactivity brings with it. So those are all very good things to do. The first question I have before we throw this open to all of you in the audience is just to clarify, Dr. Gornick, some of the overlap in symptoms between COVID-19 and cardiovascular patients who might have it. How does one determine this, and what should patients do when they're having trouble?
Well, I think that's a really good question. And as I'm sure most of the people participating know, some of the symptoms of COVID-19 can include chest pain, shortness of breath, but also fever, but cough. Some of these things can be due to heart failure or a heart attack versus COVID-19. So I think, unfortunately, the bottom line is if you're having any of these concerning symptoms, you really need to get checked out. And obviously, in the emergency room or in another setting, we can do things like an electrocardiogram, cardiac enzymes, also imaging of the chest. And if there's concern, in many cases, obviously, we rule out COVID-19.
Thank you. So in the interest of time, I'm sure that I've already seen lots of questions come by in my chat panel. So I'm going to turn this over to Tiffany so that she can moderate these questions and we can go about getting people's questions and queries answered. Over to you, Tiffany.
Thank you. Yes, one of the questions that we actually received via the chat function or the Q&A function is in regards to medication. So I would ask Dr. Rajagopalan, can you address ACE2 inhibitors and maybe some of the things that people have been hearing rumors about the medications they're taking for hypertension and other issues interacting or causing increased issues with COVID? Is there a potential increase of infection due to taking these drugs?
Thank you, Tiffany. I think this is a very relevant question. There's been a lot of concern about these two classes of drugs, ACE inhibitors and angiotensin receptor blockers. And these drugs are well known to many of our heart failure patients, as well as people with prior cardiovascular disease, because physicians often prescribe these medications not only for treatment of hypertension or high blood pressure, but also to prevent cardiovascular events. So they're often used in these populations of patients. And the concern arises from the fact that one of the enzymes, the ACE enzyme, which is really the enzyme which, there are two types of ACE enzymes, and I don't want to get into very much details, but just to say that the concern is because the same enzyme that is responsible, that the drug targets, is also the enzyme that the virus uses to get into the body. But it turns out that these enzymes are very different. And patients taking ACE inhibitors and ARBs have nothing to worry about in terms of being more susceptible to the virus. That is, to date, I think all the societies, including the American Heart Association, the American College of Cardiology, the European Society for Cardiology, are all saying the same thing, which is, if you're a patient on an ACE inhibitor or an angiotensin receptor blocker, the best thing you could do is to continue taking those medications because by reducing your susceptibility to future heart attacks, future strokes, and other cardiovascular events, including heart failure, you're much, much better off to even fight the virus. So the very strong recommendation is please continue taking the medications. And our preliminary analysis of data, there was a paper that just came out recently within the last 1 week, shows that, again, just what I was saying, which is patients who are taking these medications and happen to have COVID-19 actually are protected.
Thank you. You know, and along the same lines, we're getting some questions about hypertension or blood pressure. So one of those is, you know, I have high blood pressure. I don't have heart disease technically. So am I at a high risk as well, or is this related more to people that have congested heart failure or heart valve disease?
So I'll answer that as well, as it's related to the prior question. So patients with hypertension, it turns out, at least in surveys and analysis from worldwide experience, happen to be at slightly higher risk for complications from COVID-19. But that does not mean that treatment of high blood pressure with ACEs or ACE inhibitors, the drug that I was just talking about, or angiotensin receptor blockers, you know, are concerns. In fact, if you have hypertension, the best thing you could do during COVID-19 is to actually continue taking those medications and keep your blood pressure under control. And as I mentioned before, these medications in of themselves do not seem to interact with the virus and really are of little concern right now.
Dr. Gornick, you talked a little bit about virtual visits. But, you know, if someone has to check their blood pressure, or if they're supposed to be checking their diabetic condition and blood pressure every day, even when they're on medications, how are they supposed to do that when they're isolated? How does a virtual visit help with that if you're not sitting with them physically in a room?
Yeah, that's a great question. This has actually come up in my own practice a few times recently. I think it's something you're going to have to problem solve with your provider. That's the beauty of that virtual visit, is actually the provider can review your situation, figure out how can we keep this patient safe and tend to the issues during this situation. I think there's a couple of options. One thing, it's possible for a provider to prescribe a blood pressure kit and a home blood pressure monitor. And I've actually done that for a few patients, and they've gone to the pharmacy and picked up the monitor, and we've given them some guidance on how to do it. Some patients, their spouse or a family member had a blood pressure cuff already, and we've done a little tutorial on how to do self blood pressure checks. And, you know, we have had a few patients who just do need to come into the office. And I have had patients, I might address this too, if I may, Tiffany, say, you know, I'm a little scared to come into the doctor's office during this time. And I do want to convey to patients that even though our governor has given us guidance to stay at home, healthcare is important. And I do want patients to know that there are many safeguards in place in the outpatient clinics and in the hospitals to keep patients safe. So for example, at all of our locations, people are being assessed at the door for symptoms, their temperature may be checked, people are now wearing masks. So there are situations where patients may need to come and see their doctor, and that's okay. There are safeguards in place to keep people safe if they need to come in person.
Thank you. Can we talk a little bit about social distancing? So, you know, as the economy opens back up and people go back to work, some of the questions that we're receiving are around, you know, my husband has to go to work. I have heart disease. With social distancing, should I sleep in a separate room, or what precautions should we be taking at home?
I think if I may address that, I think the triumvirate of actions are very important. I think, you know, I don't like the word social distancing. I think it's really be geographic distancing, because in this moment of crisis, I think there's nothing better than connecting with people, using the appropriate precautions, you know, through remote means, and you know, the technology that we have affords us lots of different innovative ways of connecting with people. But having said that, the three actions of wearing a mask, washing your hands, and, you know, wearing a mask has the effect of not touching your face as well. So besides the effects that we know about in terms of reducing exposure, it also has the unintended but necessary consequence of you not touching your face. So the three things are very important. Having said that, if you have to go to work, if you happen to be in a job, for instance, the job that we work in, where necessarily we might come into contact with patients, etc., you can take some extra precautions. But if you're working in environments where there is no increased risk of exposure, other than the fact that they could be, an individual whom you might encounter, who might, unsuspected to you or even to the individual, might have asymptomatic COVID-19. And the best way to take precautions would be to do the three things that I just mentioned, which is to maintain geographic distance, is to also wear a mask when you're speaking to people, keep a little distance away, but still engage in social conversations and speaking with people. And again, make sure that you wash your hands after any encounter anywhere. And these three practices should keep you very safe. So if you happen to be in a high-risk profession, I think, you already know what are the things that need to be done. Hopefully, if you're working in a hospital like me, there are precautions that you might have to take. And hospitals in general, and in particular, UH has been very good about periodic, excellent updates, resources that really guide people working here at UH to keep not only themselves safe, but also keep our patients safe.
Thank you. We have a couple questions around having had a procedure towards the end of maybe 2019, beginning of 2020, before the pandemic really started. Open heart surgery or having an ablation for their AFib. Are they at increased risk for COVID, and what should they do about going back to work?
I can answer that question. It's a very good question, very relevant. First of all, I think every case is different. So again, we really want to individualize care to your situation, your procedure. So I really do encourage you, for specific questions about work and COVID and your procedure, to check in with your surgeon or proceduralist, your electrophysiologist. I think that is the key thing to say. And again, I would just re-echo what Sanjay has said multiple times. It doesn't seem that the heart disease per se increases the risk of becoming infected with COVID, but increases the likelihood of a more severe course. So I don't think it's that people with heart disease versus not, or blood clots versus not, are at higher risk of developing COVID, but I think all patients should take these same precautions to try to keep themselves safe. And again, I think every case is different, so please check in with your doctor about when and if you should return to work at this time.
Does a face shield, in addition to a mask, give any extra protection against the virus?
Let me answer that. A very good question. And again, the face shield is recommended for people who have very high likelihood of coming into contact with droplets. So there are obviously in the health professions, dentists, for instance, dental technicians, people who work in offices where they're doing procedures that could result in dispersion or what we call aerosolization or droplet exposure. For those kinds of situations, it's recommended that you wear a face shield because it does provide added protection to other membranes, including the eyes, as well as the nasal mucosa. And in addition to the mask, I think it's a very important measure. But for those people out, commoners who are working in regular non-health environments, it's not necessary to wear a face shield.
Thank you. We have another question that was actually submitted before the webinar around postponing procedures. So they were told, during this, when elective procedures were stopped, they need to postpone their heart test or their procedure. When will it be safe for them to schedule this, and what should they do in the meantime?
Yeah, well, I think I think things are a little bit in flux. I think we're waiting for some more information actually from our governor on this very issue. The governor did say something in the past few days, which I think is really important, about for patients with postponed procedures, checking in with their provider about the procedure. Have their symptoms changed? I mean, there may be some patients out there who a procedure was postponed because it was elective or they were asymptomatic, but they have coronary disease or valve disease or vascular disease, and the symptoms have been worse over the past 3 or 4 weeks. So I think, again, really emphasizes that need to stay connected with your provider, update your provider, and make an updated plan for your procedure.
And to add to Dr. Gornick's comments, I think she said this very well early on. I think in the event that you're having symptoms, you know, it's very important that you get in touch. And we've always maintained in our view on this matter is heart patients and patients with cardiovascular disease are the highest risk, right? Not only because their own conditions confer a risk for recurrent conditions, and at the same time, they're also, as Dr. Gornick and I have mentioned before, at risk for complications. So if you're having symptoms, there's not even a question. I think that you need to get in touch with doctors, and sometimes that might be difficult. Now, with elective procedures, where it's very clear that you can wait, clearly I think the gubernatorial mandate was relevant because those procedures were being withheld in the event that we need to protect PPEs, but now we're in a different phase of the illness, at least in Ohio, for the time being. And you know, we are waiting to hear anxiously, but we've already started plans to try to start to accommodate the patients who had their procedures rescheduled and try to bring them back in a safe manner, so that not only is it the right thing to do, but doing so in a manner where we ensure our patients' health in an appropriate fashion is also something that we are actively engaging in right now.
Another question we received is around the time being isolated and when it's okay to get together with others. So if family members who don't live in the same house want to gather, knowing that all family members have been isolated for over 14 days, or in some cases maybe 5 or 6 weeks at this point, is it safe to get together using the 6-foot distancing? Should we masks, be used by all, or do we really just need to continue being in separate houses even though we've all been home?
Dr. Gornick, do you want to take that?
Sure. Well, I think it's a tough kind of gray zone question. I think what I'm doing, I'm with my immediate nuclear family, aside from going to work and home. I think I understand people want to see family members and grandkids and in person, but I think especially for older patients or patients with cardiovascular disease, it probably is best to stay isolated, at least physically right now, because we are still going through this pandemic. And I think, unfortunately, I think the virus will be here for weeks and months to come until we have a vaccine. So I would recommend for people who have heart and vascular disease to still be very cautious and avoid groups with other people. That being said, I think, using interactive forum and electronic and things, people have been very creative with iPhones and things like that to chat. But I personally, if you have heart and vascular disease or are older, I would really recommend holding off on those family reunions at this time. Sanjay, do you agree?
I absolutely agree. Well said, Heather. There are 3 questions. With your permission, Tiffany, I think we are sort of getting to a point where we might run out of time. So in the interest of keeping things moving, I'm going to address a question, and there are 2 other questions that I'd like Dr. Gornick to address along the same lines. One participant asked a question which is kind of a very interesting question. And this individual asked, droplet spread from carriers of coronavirus is aggravated from air conditioning, and depending on the direction of airflow of the air conditioner, is it advisable for restaurants and small area businesses to shut air cons off completely until the pandemic is over? It's a very interesting question, and it so happens that I happen to work in a field where this is often a concern because I work on one of the environmental risk factors called air pollution, and air conditioning and HVAC systems are quite effective in removing particles, okay, and removing droplets, provided certain conditions are fulfilled. And those are, you have to have a filter that is changed periodically. And again, depending on how often you run the HVAC, how often it cycles, it can be very effective in reducing exposure. But having said that, it all depends on the mechanics of what you have. And at least in this climate, it would be a good idea to actually open the house out, especially as the weather gets warmer, as the primary thing to do. That's probably a good thing. But HVACs, if they are running effectively, can be quite effective in reducing exposure. But again, as you point out, the directionality of the air conditioner and other factors might have to play in. So it's a complicated answer. There are two complicated question and answer. Two questions relating to risk. One person asked, well, I have an elevated calcium score. I'm a diabetic, very concerned about my heart health. What should I do? I think it's a very good question. I think you should do what you would have done even outside of COVID, which is really to ensure that you consult with your doctor. You can do that with a live telehealth visit, with a virtual visit, and this can be very effectively addressed. If you want to make sure that you're taking the right medications, that your blood pressure is controlled, your blood glucose is controlled, etc. There's a question that's, I think, directed at Dr. Gornick, which relates to large vessel vasculitis being at increased risk. So I'll let her address that before getting back to you, Tiffany.
Sure. Well, large vasculitis is an inflammatory vascular disease, and usually patients are on immune suppression. So again, I think that would be one of the conditions where it's not necessarily increased risk of contracting COVID, but yes, I think there is increased risk of a more severe course if the person is on immune suppression.
There's a question on here in regards to the anticipated time for a vaccine being available. Do you have any update on that?
That's a great question. As you know, the vaccine effort in the United States and in fact internationally is a very, very active space. In the US, there are many companies, including a company called Moderna Therapeutics out of Boston that's sort of pioneering a number of trials. There are industry partners, including companies like Sanofi, Janssen, that are in the race for developing a vaccine. We just heard yesterday, actually 2 days ago, that the Oxford group is sort of engaged in a very large vaccine trial in 4 different countries all around the world, and they expect to have results as soon as September. Kind of hard to believe, but I think most individuals from the CDC and certainly Dr. Fauci, on television, has been saying that it might be a little longer than that. It might not be until the first quarter of next year that you might actually have results. But again, it's a very, very evolving space, and I'm not sure I have the correct answer, but I think those are approximate answers as to what the timelines may be. So let me take 2 other questions with your permission, Tiffany, and I'll sort of take turns here and do one and then have Dr. Gornick address the other. One of the participants asked, my blood pressure has been under control, but yesterday it was elevated. I feel okay. And she obviously checks her blood pressure very often. She has a virtual visit scheduled. And the primary physician suggested that she just watch it. I really think it's stress related. Well, I think this is part of it. I think we have tremendous amount of stress. Clearly, blood pressures can fluctuate because of stress-related conditions. The best thing you could do is to keep a diary, a catalog, and measure your blood pressures at various times a day. Typically, I would say at least twice a day, 3-4 times a week. Turns out that some of these home blood pressure monitors, if you measure it the right way, are actually very accurate. And having a series of recordings can be very helpful to your primary care physician. So if you could provide those to your PCP, you can average the blood pressures, and that can give us a very good sense of what your blood pressure control is. And then based on that, your PCP can decide whether they want to act on it or they want to, wait and see for a little while longer. A few more questions here. I'll turn this to Dr. Gornick. I have bradycardia and SVT. Am I at risk? Many of these questions are related to complications of COVID. Bradycardia and SVT. Am I at risk for complications of COVID? Autoimmune disease. Does it put me at risk for COVID? Dr. Gornick.
Yeah, I think it's hard to say for every specific disease and COVID risk because we're still just learning about COVID. But again, I think the big categories of risk seem to be heart disease, lung disease, diabetes, and autoimmune conditions, especially patients on immune suppression. Sanjay, can I reply to one question I see here that's very important and a comment? Someone did send through a comment on my earlier statement about not having family reunions and said maybe we could do it outside, very far away, socially distant outside. And I think, again, it's funny. I took my kids were talking about going to see grandparents from across the street just to see them. I think there are ways to get around that. But what I was referring to was people all being together, gathered in a home, having a meal. There was a very important question about someone on Coumadin for a metallic mitral valve and anything specific to know. And I do think that's a very important thing to address. If you are on blood thinners and especially on warfarin or Coumadin, you do need to continue to get your INR monitored. And our Coumadin clinics have developed some slightly different protocols during this time of the COVID pandemic, but we are still open and able to monitor your Coumadin. So yes, please do continue to get an INR check. May be able to do it a little less frequently, but you still definitely need to have your INR checked.
That's great. There are two more questions, Tiffany, with your permission, I'll address these. One is, does the patient go into DIC secondary to COVID? Well, it turns out that Dr. Gornick is a world's expert in clotting disorders, and I'll let her address this because you could really hear it from her. Dr. Gornick, what do you think about that, DIC and COVID?
Yeah, we are learning more and more about this, honestly, every day. It's been hard to keep up, but there does seem to be, in some patients with COVID, the more severely affected patients, a clotting disorder, similar to what we call DIC or disseminated intravascular coagulation, a clotting disorder where clots do form, including clots that can develop in the lungs or potentially in the small vessels of the heart or the brain, or even the arteries of the legs. So there does seem to be clotting problems that develop in the most severely affected patients with COVID. And what the medical community right now is working on is figuring out how to prevent this. So different groups of hematologists and clot specialists are working on different guidelines for how to treat a patient with COVID who comes into the hospital should they receive some low-dose blood thinners. But again, this is evolving so rapidly, but it's something that's very much on the radar.
Great. This question, which is interesting again, and I think this is a recurrent theme that we are faced with, with patients alike and sometimes even colleagues, which is, how do you get past the fear of added exposure to the virus when deciding whether or not to come in for a scheduled appointment? And it's a very legitimate question. And the way I'd like you to think about this is to really take advantage of a virtual visit, discuss this with your physician, and it can be very effective. Some people have a lot of doubts about the effectiveness of a virtual visit. I certainly think, and Dr. Gornick agrees, that you can probably get a lot out of the appointment because, one, you can sort of discuss these various conditions, get to some kind of agreement whether your condition or symptoms necessitates an in-person appointment. And at that stage, I think, as Dr. Gornick mentioned, we've taken extraordinary steps, at least at UH, at all our facilities, to ensure that there's geographic distancing for people when they come in, that all physicians are attired appropriately, and everybody's using appropriate guidelines to ensure that there's absolutely no risk whatsoever for you to be exposed to any added exposure risk to COVID-19. So that's the way I would sort of graduate, go start with a virtual visit, address some of these questions. And if you can address it successfully, there might not be a need for you to come in, at least for the short duration. over the next few months. But if you do need to come in, we can certainly organize a visit that's consistent with guidance and ensure that you're not being put at risk.
Sanjay, may I address one question related to that? Good question about how about patients asking, I'm due for my echo and my CAT scan, perhaps to monitor my valve or my aorta. I have patients with my vascular conditions who get ultrasound exams. And should these studies still take place? Again, this is something that is evolving as we work through the pandemic, and also in Ohio, the directives from our governor. But in some cases, these studies have been deferred if they're truly elective and it's your annual check-in on your aortic size and it's been stable for years. We can push it out a few months, but at some point we don't want to push it out too far. And again, if this continues in some fashion, we could potentially be having issues with COVID for weeks to months. So again, I think for that, it really is customized. What are you having the follow-up imaging study for? And is it okay to wait 6 months or skip this year? So again, cannot emphasize enough our message that we're really hammering home is every heart and vascular condition is a little bit different. And please check in with your provider. And these are perfect questions to be asked of your provider.
Great. Back to you, Tiffany.
Thanks. I think we have time for one or two more questions here, and then we'll wrap it up. There's been one that's on the chat here. So I have mitral valve prolapse and AFib, along with a breathing condition. So again, along the lines of returning to work, especially if they work with children in the daycare or other maybe at-risk populations, is that something they need to talk with their doctor about, or how are you advising people in regards to when to return to work?
Well, I would say that's a complicated question because, if you're working in an environment, especially young kids, I hope they're not conducting school as of yet. The last time I checked, my kids are still tucked in at home doing, remote learning. So I hope that, the facility that you're referring to is obviously something that they've put a lot of thought into. But having said that, if you have, based on your underlying condition, I don't want to read too much into it. I would say that you take the necessary precautions and again, avoid situations that might put you at risk for exposure. That's the only thing I would say. There's another question here, again, with the same theme that we've talked about in terms of whether or not certain conditions put you at higher risk. We talked about elevated calcium scores, people with high blood pressure, people with diabetes. Another question related to Lp(a), which is a highly specialized but rare condition of a lipoprotein disorder or a type of fat level that goes up in the blood. And these patients are at risk for stroke as well as heart attacks. And again, I would say the same thing. I would just say, do the common sense things that you've already been talking about in COVID-19. And again, speak to your physician about what you might need to be doing to address those risk factors that put you at risk. So that's the only thing I would say. Two questions here. I guess we'll sort of take turns again. Would you recommend vitamin D to prevent ARDS for COVID? So this is getting into the specifics of treatment of COVID-19, et cetera. And I don't think this is the appropriate forum for that. What I will tell you is this is a tremendously active space because every day there is a new paper, there is a new treatment often being proffered, but all of these need to go through rigorous testing. You hear a lot of things in television, including from our president, about therapies, but these all need to be vetted with carefully done randomized controlled clinical trials. And there's an awful lot that we don't know, unfortunately, about treatment approaches. So I'll turn this back to both Dr. Gornick and Heather. We have a few minutes to conclude. I guess we'd love to sit here and answer more questions, but I'd like to turn this back to them, to Tiffany first, and then over to Dr. Gornick. Tiffany?
Sure. Thank you both for your time and sharing this information with our audience. I guess I would ask if either of you have anything to add in closing at this point.
Well, I think, first of all, I really appreciate the interest and engagement. I think you got the message, which is basically we are here to help you for your heart and vascular conditions. And we are very much ready to take your questions and care for you. And we just want to make sure you continue to get good preventive and good continuous care for your heart and vascular conditions so you don't develop those severe symptoms and need to come to the ER. So again, thank you all very much for attending, and thank you to Dr. Rajagopalan and Tiffany for having me.
Thank you, Dr. Gornick and Tiffany. Excellent job organizing this. I'm hopeful that all of you that participated found the session helpful. Certainly, I found this very insightful and helpful, and having the opportunity to engage with our patients is what we do on an everyday basis. So this gives us a tremendous amount of pride and pleasure to be able to spend this time with you. I must say that we have a very exciting lineup of educational webinars. And I think if we could switch the slide over to the, I don't know who does that. Maybe there you go. These are some of the resources, as Dr. Gornick mentioned, and these are the upcoming Heart and Vascular webinar series. As you can see, we try to organize this, at least 2 of these sessions every week, and they really are patient-facing seminars. And many of these are world experts in various conditions that can provide you a lot more information. So I hope this is very helpful to you. And again, feel free to reach out to your doctors, your primary care providers, or cardiologists with added questions. And don't forget to make a virtual visit appointment if you have any further questions or concerns. Once again, thank you. Have a great Friday and the rest of the weekend. Bye-bye now.
Bye-bye.
This concludes today's session. Thank you for attending, and we hope you join us for other upcoming webinars. As a reminder, to schedule an appointment with a University Hospital's cardiologist or vascular specialist, please call 216-465-7893. Have a great afternoon.